Joining us now is David Drucker, senior writer at The Dispatch and an MSNBC contributor. Basil Smikle is former executive director of the New York State Democratic Party and an MSNBC analyst. So 8 words, David. Cancel the cuts, lower the costs, save health care. Is that the slogan that's going to give Democrats an advantage over Trump and the Republicans, because this fight is looking to get messy?
Yeah, that's doubtful. Americans don't like government shutdowns. They think they're an illegitimate form of political combat. And all the messaging in the world usually doesn't solve for that. You know, I'd point you back to 2013 with the Republican-instigated Obamacare shutdown, where they were trying to defund the Affordable Care Act, which at the time was rather unpopular. In fact, it was extremely unpopular. But Americans still didn't like the idea of using the government, funding for the government, and keeping the lights on as leverage for Democrats agreeing to push off one of their signature priorities that had passed through the legislative process. Americans just don't tend to understand why you can't fight for your priorities, propose legislation, and negotiate while keeping the government up and running.
So, Basil, look, YouGov polls, both in 2024 and this year, 2025, found a majority of Americans feel the Democratic Party does a better job of handling health care. We know people want their health care. They like their health care. Having said that, is there a risk in this?
No, I agree with David. Most Americans don't want a or don't like the idea of a shutdown, and a lot of this depends on the Democrats' ability to message it properly. But if you're going to pick this fight, I do think healthcare is the fight that the hill that you die on. And from this point of view, when you look at what's coming from Washington right now, the RFK Jr. has talked about changes in the way we think about autism, changes in the way we think about vaccines and administer vaccines. There's a lot of policy confusion around where to go next. When you
Can I take Tylenol?
Can I take Tylenol? When you couple that with the cuts that are coming from the administration with respect to Medicaid, changes in the Affordable Care Act, I think this is an issue that crosses party lines. So if you're going to fight this fight, I think healthcare is what you choose.
So, David, talking to Nicole Wallace, Jeffries also framed this battle as a moral imperative. Here that is.
We're not going to simply bend the knee to Donald Trump's will when he's gutting health care for everyday Americans and actively hurting people. That's immoral, and it's not something for us to participate in.
He lays out that this is happening in real time, that in California, at least 2 rural hospitals could soon shut down, with more of them at risk. In Boston, a nonprofit medical service provider for the homeless is laying off 25 workers. So is that the real threat here for Republicans if this stuff starts to unfold, I guess, simultaneously? Or how do Republicans respond if stuff like that starts happening?
Well, look, there are 2 different issues here, right? I mean, there are vulnerabilities that Republicans face on the issue of health care, and vulnerabilities that are going to come out of the, what is officially known as the One Big Beautiful Bill Act, that reconciliation package that is going to impact how Americans receive health care and what they pay for it. That's the sort of thing that I think Democrats can fight and win on in the context of the 2026 midterm elections, at least, as things are framed and as things are framed now, and what we think is going to happen from a policy perspective over the next year plus. The question is whether or not shutting down the government is the right way to win on that issue politically. Because I'm not passing judgment here on what Democrats, feel is the moral thing to do. But if this unfolds like basically every other shutdown that we have seen going back to the late 90s, the party or president that instigates the shutdown as a means to extract a policy achievement ends up losing that debate with the American public. And then they end up folding. So if you're not going to if you're going to frame this as not bending the knee to President Trump, and that's a message Democrats want to hear, and I totally understand that, I don't know what they're going to say in 2 to 4 to 6 weeks from now when they essentially bend the knee to Trump, because the Republicans are on the right side of the shutdown argument, even if they're on the wrong side of the health care argument.
Well, I guess the question is, if there's a shutdown, Basil, and whoever gets blamed, does it have legs? It's different now. We are in a different environment because so many things happen so quickly. But if there's a shutdown, if we see something in 2 weeks or 4 weeks or 6 weeks, does it have the potential to impact the midterms, or is that just so far away?
Yeah, 1,000 things can happen between now and the midterms. But to the earlier points, as I said before, this really does depend on a Democrat's ability to message this properly. They're going to have a machine that goes out into these rural communities and really talk to voters about why this was actually necessary. Because
are they ready now? Are they ready to do that?
I hope so. To be honest with you, that's my concern. No, I didn't make it very definitive. No, that is my ultimate concern, because in the past, and David's right, in the past, and I think even Chuck Schumer has talked about this, they want to be able to make a stand, but they are concerned about that Democratic machine, that messaging machine, to be able to go out and actually talk to voters. I do feel we are in a very different moment. I mean, I'm going to Chemung County, New York tomorrow, to a county in upstate New York that's had 50 years of Republican county executives, because they want to be able to talk to people about, what do we say to voters? What do we say to our neighbors? So if the Democrats are going to be that granular, that grassroots, and really go into these rural communities, I think it can work. But remember, with a shutdown, potentially people are not going to get paid. So when you add that to the other layer of economic concern that voters have, that's why it's not recommended that we go down this path. But if you're going to make a stand, I think talking about health care is the stand to make.
Yeah, and let's not forget, federal workers are not largely in Washington, D.C.,
right,
as some people may think. They're all over the country. So since you brought up Chuck Schumer, let me bring up Democrats putting not just the emphasis on health care, but Schumer, who was on Morning Joe today, says there has to be this pressure that's being felt over rising costs overall. Here's what he said.
The view of Trump is declining because costs are going up, not just health care costs. Your energy costs are going to go up because of what was in that BBB. The tariffs, they're killing people. I just had one of my colleagues out in Iowa. All the farmers could talk about was how the tariffs were killing them. So people are getting really upset with Donald Trump.
So I know we say this all the time, David. We know it's all about the economy, but what legs does that have versus a government shutdown, if it happens or doesn't happen, ultimately, because we're all looking ahead to the midterms and who's going to control the House and the Senate, this overall big picture of prices?
Yeah, look, I mean, affordability is the number one issue voters care about. And in 2022 and 2024, we talked a lot about inflation, and it really has morphed now into this overall concern, even from voters firmly in the middle class and on the upper fringes of the middle class, that life in general is either unaffordable or much harder to afford comprehensively, holistically. So it's not just about grocery prices or what you're paying at the gas pump. Every time, every election cycle that comes around, I talk to Democratic strategists, Republican strategists, and usually they'll look at a president's vulnerability, whether it's their president, the president of their party, or the opposing party, and they'll talk about the need to put together a plan, an alternative to offer voters, and then you hammer the opposing president and his party over the head with their vulnerabilities, and then you tell voters, and this is what we're going to do. A government shutdown is not necessarily how you accomplish that, but there is a huge opening here for Democrats. What they're going to need to do if they're going to be as successful as possible, and we can look back on past midterm elections and see this, is not just point out the president's flaws, but then explain to voters what you would do if you were given the power to do something. Explain what you would do if you had the power to negotiate with the president in a real way over government funding and other policies, because you would control at least one branch of government.